Good morning, everyone, and welcome to the second day of the LIberalism Conference 2021. My name is Ali Iskandar, Communications from Ideas, your MC for today. Before I begin, please allow me to begin with a short housekeeping announcement. At Ideas, we are committed to provide a safe environment for all parties, both internal and external, to work together. Ideas has a policy of zero tolerance towards sexual exploitation and abuse. Everyone here is responsible for making this event a safe space for public discourse. It is commonly claimed that COVID-19 exposed weaknesses in the globalized economy. Major population centers around the world underwent lockdowns and restrictions, bringing everyday business activities to a halt. In response, countries around the world resolved to adopt massive fiscal measures to keep individuals and businesses afloat. Has COVID-19 exposed the weaknesses of the globalized economy and our reliance on global supply chains? Can the future market become sustainable, especially in weathering future pandemics? What could we learn from COVID-19 with regards to market liberalization? To answer all these questions, I would like to pass the floor to my colleague, Sri Murniati Yusof, Senior Manager of the Public Finance Unit at Ideas, to moderate the second session of our two-day conference, The Rise of State Intervention in the Weathering the Economics of COVID-19. The floor is yours, Sri Murniati.
Thank you, Iskandar. Sorry about that. Thank you, everyone. And thank you for coming to the second day of Ideas Liberalism Conference. This is the second session of the conference, and we are going to talk about the rising of the state intervention in weathering the economic impact of COVID-19. So as Iskandar said earlier, there's a widely held assumption that because of the COVID-19 pandemic, the governments all over the world are taking a more active and direct role in the economy. They are providing loan, grants, and other types of financial supports for companies, either to provide liquidity or even at some point to bail them out. And in some countries, of course, the government bail out and then buy the shares of private companies, increasing the level of the state ownership in the economy. So some call this phenomenon as the return of big government, or even the return of state capitalism. So of course, while the rising state intervention seems to be inevitable during the pandemic, I think the question that we can ask together is, can we strategically use this increasing state intervention for economic recovery, for a more strategic economic recovery, as well as for the long-term economic development? So today we are going to discuss this topic with three prominent economists who are here with me already. So the first speaker is, we will have Dr. Carmelo Ferlito. He is a CEO of Center for Market Education, who is also our senior fellow. The second speaker is Nadia Jalil. He's a regional head for group economics and market analysis at CIMB. Morning, Nadia. And then the third but not least, Hafiz Nur Sham. Hafiz is a fellow at REFSA, and he was also he's a former special officer to the finance minister during PH government. So welcome to all of you, and very nice to have you all here. So we have 2 hours discussion. So I will spend about first 50 to 60 minutes to discuss some basic questions to generate discussion among us. So I will ask 3 questions to the 3 speakers, and then after that, I will invite everyone to put your question in the Q&A sections here. And if you are following us through Facebook, feel free to put your questions in Facebook as well, and our team will forward those questions to me. So again, looking forward to having this discussion with all of you today. So okay, let's start. I think the first questions is, as I mentioned earlier, so there's a widely held assumption, right, that the government is increasingly becoming big during this pandemic. Do you think this is the case in Malaysia, Nadia? And I think what would be the form? Are there different forms of this state intervention during COVID-19 globally and also within our country?
Hi, thank you so much, Ideas, for inviting me for this very interesting panel this morning. And thanks, Uni, for the question. Really, in terms of the government's responses to the pandemic, and I'm going to speak about Malaysia first. Given the unprecedented nature of the pandemic, and I know unprecedented is really an overused word in an unprecedented manner when it comes to the COVID-19 pandemic, but given its unprecedented nature, the government's responses in Malaysia hasn't really been that new in terms of how the Malaysia's governments, whether it be the previous Prihatin national government or this current government. For instance, in terms of fiscal interventions, whilst the various plans did total up to about 26% of GDP, direct fiscal interventions only comprise about 5% of GDP. And compared to countries such as Singapore, which committed about 20% of GDP to direct fiscal interventions, including wage subsidies, which we also had, but in a relatively limited manner, as well as supports for businesses, as well as direct cash transfers. It really would seem as if the level of state intervention that we've seen so far in Malaysia compared to our regional neighbors, Singapore, I've mentioned before, as well as Thailand, which actually committed about 8% of GDP, so slightly more, to addressing the gaps that were highlighted during the COVID-19 pandemic, was not as large as it could have been. Granted, it did help to ameliorate the negative effects of the COVID-19 crisis, both on our health systems as well as our socio-economic structure. But I think given the scale of the crisis, more perhaps could have been done, particularly in terms of widening areas such as social safety nets, as well as supports to small and medium or micro enterprises as well. We saw, for instance, that the household income dropped quite significantly between 2019 to 2020, with about 10,000 households actually shifting from what was previously the what was called the M40 and it's now the B40, or rather it's a case of the household income curve itself actually shifting to the left and actually reducing by a significant amount. So that would indicate that actually in terms of Malaysia's, the Malaysian government's response, more could have been directed in that sense in terms of dampening the immediate effects of the crisis. So I think we're going to talk a bit more about the medium term and the long term strategic interventions that could be done later on.
Okay. I will have that questions to you on that. So I think let's hear from Dr. Carmelo first.
Okay, thank you, Ideas, thank you, Uni, for having invited me. I would say that if we talk about state intervention in the economy or state capitalism in the traditional way to think about it, we haven't seen it, okay? In other emergencies like the 1929 crisis, in certain countries, we have seen the government, the state, becoming the major shareholder of the economy. In certain countries, as was the case also of my country, where the fascist government came to buy something like 45% of the capital in the economy after 1929. So we haven't seen that. We have seen a totally different kind of intervention that has been more spot interventions with all the unintended consequences that we will discuss later on. So I don't see a rise of state capitalism in the traditional sense, but obviously what I want to argue here is that instead the crisis was precisely generated by government intervention. So we could have chosen a different way to handle the pandemic. So the pandemic itself didn't generate the economic crisis. That was generated instead by the response to the pandemic, by lockdowns. And the WHO, in a document on pandemic management published just a few months before COVID-19, was listing a series of measures to handle pandemic, among them lockdowns, and the WHO say that we have really little or no evidence about this kind of measure working. WHO just few months before COVID-19 emerged, but this document was completely ignored. What I want to stress here instead, in terms of the danger of government intervention through lockdown, is a more, if you want, philosophical or preliminary approach on the role of the state on the economy. This has been the distinction between essential and non-essential services. This has posed a very dangerous precedent in the way in which the government can intervene in the economy, for two reasons. One's very technical, so to think that we can really distinguish what is essential or non-essential for the economy means that we have never done anything in the economy. So that distinction in practical term is impossible to be drawn. I always made the example of farmings. Farmings require a lot of things that are not, technically speaking, farming, like motors, like oil, like transport, logistic, carton boxes, plastic boxes, and these kind of things. And how can you eventually tell a producer of carton boxes to produce carton boxes only for the farms? So this is obviously unrealistic. But then there is also an even early stage, that is the government, by telling which businesses are essential, is basically telling to the people first what is essential for them to consume and what is not essential for them to consume. So the government is replacing the individual in the choice of the scale of preferences. And second, the government is telling who can survive and who cannot survive. Because by telling to the barber that they cannot operate for 1 year, they are telling to the barber that he doesn't need to eat or to feed his family for 1 year. Because you can force me not to cut my hair for a year, and I can eventually agree for emergency purposes, but how can the barber accept not to feed his family for a year? So this distinction, this possibility for the government to intervene with this distinction and the massive acceptance of this distinction, I think has posed the major threat to really the normal functioning of a normal economy, from the people perspective and from the possibility for the people to choose how to live their lives.
Thank you, Carmelo. I think we have a quite controversial topic here, and we can continue discussing it. But Hafiz, you can comment to both Nadia and Carmelo as well. Also, saying your points about this question. Go ahead.
I think I'm going to take a little bit of middle ground.
Go ahead.
But going back to the question before commenting on the statement that you said just now, I think it's not a question of whether there was government intervention or not. I think there was definitely intervention all around the world. I think the question that should be what kind of intervention that we should tolerate and what intervention is possible, and whether enough has to be done. I think in terms of government intervention, I think it was inevitable in terms of lockdown and also the incident of assistance, right? Because the thing is, for the first couple of months, in fact, for the first year of the pandemic, we pretty much didn't know what was going on, how COVID spread. For instance, there were suspicion, but there was no real proof, right? How it was transmitted, what is the vector, or what origin, whatever. So, given the uncertainty of the situation, Nadia has mentioned that it was unprecedented, which was unprecedented. Although the word itself is becoming a little bit of cliche after 2 years, but there was also uncertainty in the first year, especially, right? And there was no vaccine. Vaccine were coming probably 6 months down the road, and it hasn't been deployed that much. So, given the uncertainty, it was important to adopt precautionary measures because we just didn't know what was going on. And lockdown was a very blunt tool, that's a given. But given the situation, I think it was the best method to approach. But the thing is, if you do lockdown, that's one government intervention. The other government intervention has to come in as well. That means providing support, because if financial support at those affected, especially pretty much the whole population. And this is the problem, right? If you want to do government intervention in terms of lockdown, then you have to do the other intervention in terms of government support. The thing in Malaysia was that we didn't give enough support. In fact, a lot of people suffered because of lockdown. So we wanted to address COVID, but we created another problem because of lockdown. So this was a problem for the whole year. In fact, for the past 1.5 years, I suppose, like 18 months, because our lockdown was quite long. And the lockdown was quite comprehensive as well. School was closed, nursery was closed, workplace was closed. So it was serious economic repercussion. And that's, I think, my argument. We have to look at the intervention, whether the intervention was right or wrong. And in terms of Malaysia, I think it was 50% right and 50% wrong. We did one thing in the lockdown, but we forgot to provide enough assistance. And that lockdown that came without assistance probably caused more misery to the population. And of course, it doesn't help that some of the intervention was very hypocritical, right? There were a lot of mistakes made that made the lockdown longer than it should. In terms of politics, in terms of the election, that was done very badly. The EC especially should be criticized for failing to provide safe election. And the EC has another opportunity to do this in Malacca, but given the SOPs, I think it's still I think it's much to be desired. But I think I'll stop here. I think
okay.
That's my comment.
I would love to discuss whether lockdown is a good intervention or not, but let's put that aside for now. It happened already, right? So, but I think let's discuss about, okay, we took this action already. Our government took this action that, of course, that exacerbate the situation that makes the economic situations becomes difficult. But then Hafiz argue, for example, that it's not enough. So I think what I remember, the government by that point provide bantuan Prihatin, right, which is a social cash assistance. There's a different cash assistance for different group. There's a wage subsidy. And also, I think, Nadia, I would argue to your point that yes, direct fiscal injection is small, but we also use SOE. We basically mobilize EPF, KWSP, SOCSO, all the network of GLC to actually provide supports to the public. So what was missing? I guess what was missing during this period?
Can I jump on that first?
Okay, go ahead.
Okay. Just to give an example, right? Back in 1998, there was an Asian financial crisis, and it took probably 15 years for the economy to get back to where you would have been if the crisis didn't happen, right? If you draw a line based on the growth rate of the 1990s and the 80s, you will come to a point in the chart, and the real economy only reached that point in 2014, 2015, right? And that situation will probably happen again for our case in 2020, 2021, 2022. We don't know how long. In fact, growth trend is much lower right now. I think in the long run, it will take a long time to get back to pre-crisis level. In fact, household income especially will probably see the same thing, right? The thing is, one counterfactual, which actually happened in the US, is that they provide a large support. And if you look at the US chart in terms of household income, you could see the trend for 2009, for instance, right? For the subprime crisis, you see that household income growth trend was 1 week before the 2009 crisis, and then the growth rate dropped and it was slower afterwards. But in this crisis, because the US provided a lot of support, that trend was just a straight line. That shows a kind of what kind of sufficient support that we need. In Malaysia, that didn't happen. In a lot of places, that didn't happen. In the US, it was extraordinary, right? Because the number was shocking, but that was the kind of response that was appropriate.
Okay, I will get back to that. Not only numbers, but also is it number alone that matters, right? So Nadia, and then Dr. Carmelo. Go ahead.
Thanks, Uni. Yeah, just to jump on your point and also to add on to Hafiz's point in terms of the right sort of state interventions. What we saw, well, you mentioned EPF, and I think that's a good jumping off point when we're discussing the types of state interventions that would be effective and what would be ineffective. So yes, in the short term, allowing people to take out their pensions in the short run would have helped quite a few members of society to actually alleviate the impact of the negative economic impact, both of the COVID-19 pandemic and, as Carmelo rightly pointed out, the lockdowns related to the pandemic. But we don't know we could kind of know what the repercussions are going to be in the long run. I mean, I think we're pretty much headed towards a sort of pension crisis, right? Unless we very quickly manage to top up the amount that was taken up. I mean, it's quite shocking actually. I think I could be mistaken, but I think it's nearly about 90% of EPF members have actually taken out, and that's really severely depleted the pension funds, and we've not really examined the repercussions of that. And Hafiz is right in terms of the fact that we had government intervention on one hand, which would have possibly, arguably, been right in the very short run in terms of imposing a nationwide lockdown, but we did not really account for the cost of that lockdown and didn't really mitigate the cost of that lockdown on households. So that's one way that we think about it. And that then begs the question of whether or not Malaysia is going to use this crisis as an opportunity to restructure some of how we actually think about providing support to households and the right sorts of support, right? We haven't really spoken about developing a comprehensive social safety net, for instance. We haven't really examined what sustainable unemployment insurance system would look like. And that's some of the factors that we really need to question when it comes to, not just whether or not the level of state intervention was too large or too small, or again, we're talking about what the right sorts of state intervention is.
So, okay, let's put this in right away. So do you see that withdrawal of EPF is a wrong move by the government?
Yes, actually, in a way, because it should really have come, you're essentially allowing people to deplete their savings without providing a stable and strong social safety net to make up for that shortfall in the future. So, in the short term, people did, it kind of did help to mitigate the negative impacts and help to top up the loss of income, but that's a very short-term approach, and it could be quite myopic really if you don't try and fix the incoming pensions crisis soon, because already before the pandemic we already had a sort of incoming pension crisis.
Yes, so yeah. We will talk. I think right now we've been talking about like a very short term during this first 3 months, right, or even 5 months of the pandemic. We will talk about midterm, but long term. But I believe Dr. Carmelo has a lot of points to say. Go ahead, Dr. Carmelo.
I agree with what Nadia said, that indeed certain measures that were proposed at the beginning may have helped the racket, so like the EPF withdrawal. But the problem is that indeed the more we were coming to know the pandemic and the more we were realizing that the pandemic was not going to disappear anytime soon, and we have seen that basically all the countries everywhere in the world that have skipped a very strong first wave have experienced these strong waves later. What has been missing has been a wider strategy. So we have kept on doing these short-term moves, wage assistance, EPF, giving some money to the taxi drivers and so on and so forth, but without a comprehensive and targeted strategy first, without an exit strategy. Okay, so without a plan to go back to normal, without thinking about the unintended consequences of all these measures, and later maybe we can speak about it. I foresee very much an inflation crisis coming. And moreover, without investing where we really need it. So we lost the chance to strengthen the healthcare system. I think that that was probably the only place where we should have spent money by ICU units, oxygen. I mean, really targeting expenditures that were addressing the real nature of the crisis. The crisis was an healthcare crisis but we didn't address any healthcare issue. We didn't reform the healthcare system. We didn't reform the social safety net. So we have lost a big chance to address some of the systemic issues of the Malaysian healthcare and social safety net system. And now everybody has the mouth full of the word resilience, resilience, resilience. We have all to be resilient. And in the end, we have lost the occasion to make our system really resilient to future crises, because we hadn't addressed the real problem. We have only put little patches on a hole that was becoming bigger and bigger. Furthermore, putting the foundations for a more structural economic crisis that I see coming as soon as the economy will be on the recovery path, and therefore the real nature of the inflation threat will be on the way, as we already see on the way. Just to give you some example, at the very beginning, we have suffered a massive supply side shock, okay, that has affected badly the supply chain, and we are starting to see the damage under that perspective only now. And in particular, we see it now after the basic aggregate monetary supply M0 has grown in 1 year of 13%. Just to give you a very practical example, to ship a container from China to Europe now costs almost $20,000. To ship a container from Europe to Australia, it costs 12,000 euros. When it was used to cost 3 or 4. A container from Europe to Malaysia that was used to cost around 1,500 euros now cost 3,000, 4,000 euros.
So
this is going to be heavy on Malaysians' pockets.
We have this like list of several systemic issues, and of course now we talk about supply chain issues as well. And I think we will talk a little bit about how actually the government midterm plan, right? We have a national economic recovery plan. We have recently have a 12th Malaysia plan. How do you see these plans actually address the systemic problem? But before that, I think I want to ask Hafiz to just talk a little bit about the US economic stimulus package that is so different with other countries. Well, first in terms of size, that can actually help alleviating, making the crisis less, less destructive. So Hafiz, go ahead.
I think the US, in terms of strategy, they didn't do much difference compared to other countries like in Europe or Malaysia or Australia. In fact, the only difference really the size. The size was extraordinarily strong. It's like even right now they are still talking about massive spending at 3 trillion. That seems to have come down a little bit because of negotiation, but just the size of it. The size was enough to counteract what it would have been if there was none done, and if income would have fallen. In fact, it's more than compensate the falling income. In fact, US household income rose during the pandemic.
So this is direct fiscal injection, yeah?
Yeah, this is direct assistance. That is actually cash. It's not your grants,
saving.
it's not whatever. It's not your saving. It's actually cash from the government. It's straight from the government bottom line. It reaches the deficit. But that kind of intervention that we needed, right? In Malaysia, like Nadia said, it's about 54% fiscal inflation, but that's hardly enough. Household income fell more than that. In fact, just one number to show that how it was now is that the GDP fell down quite badly, right? 7%, 7%, if I'm mistaken. And the support the government gave probably shaved I don't know, 1 or 2 or 3, 4 percentage point off the drop. It didn't cover the whole drop. So that showed how it was enough. And you could see a suffering in the street. You don't have to look at numbers. You just go. When if you had a opportunity to go out, people suddenly now is becoming, there's more people at the traffic light selling, like it's sandwich man, right? Jual manga at the traffic light. That didn't happen probably 10 years ago. In the past 1 year or 2 years, you see more of these people. More people doing second jobs, third jobs, because of what happened. The system wasn't enough. And then we haven't even talked about assistance in terms of children's, right? Our like those school-going kids lost 2 years of school, and in 10 years' time, 5 years' time, that would affect their potential income growth.
I have a slight complication here. Wait, sorry. This
But
is the problem of having, yes. Yes, go ahead. Okay, apologies for that. Okay, let's talk about this. But I think another problem that giving this really huge fiscal injections is also the capacity of the government, right? Whether we can, I think we can talk about that, but I'm interested to address this question that we talked earlier about the midterm economic plan to address the systemic issues that was not being addressed in the first place. So how do you see, well, the latest plan, the 12 Malaysia plan, actually address this, the systemic problem that you see, you mentioned just now? I think let's start with Nadia first.
I like that you always start with the difficult questions with me. Thanks, Uni. Well, in terms of the 12 Malaysia plan, I think we had a short discussion about this before the panel started. I think it gave very broad directions in terms of where the government saw the economy heading in the next 5 years. But I don't know if there was enough recognition that this is really, again, I hate to use this word, but I have to, an unprecedented moment in not just our nation's history, but also in terms of the history of global economic growth and recovery. What the pandemic highlighted was really in terms of the fissures that already existed in our socio-economic structure, right? It didn't create, as I think Carmelo highlighted earlier on, it didn't create any new fissures. It merely highlighted what was existing earlier on. So in terms of, say, the gaps in our healthcare system, as well as the gaps in our education system, and also our social safety net system, I don't know whether the 12 Malaysia Plan has adequately addressed those issues. I mean, there are sections in the 12 Malaysia Plan that do are dedicated towards improvements in healthcare as well as education, and a very short section on improving the social safety nets. But I think what we need to see is more details from those plans. I think one area that we can actually pick on is in terms of healthcare investments. I'm not sure whether there's enough recognition that, this pandemic, as a lot of scientists have started pointing out, won't be the last global pandemic that we're going to see. Are we prepared enough to meet the challenges of any future pandemics? Are we actually looking at how we can deliver public health services as well as other health services better? Are we looking at, say, a national health insurance system in order to alleviate the burdening costs of providing healthcare to the people? That hasn't really, you don't really see that in the system. And, in terms of the upcoming budget, given that the Malaysia Plan typically feeds into the development expenditures of subsequent budgets within that 5-year period, I think it's really important to actually elaborate and add more details on that, because as Dr. Carmelo pointed out, if anything if there's any sector that desperately needs increasing government support and public investments right now, it's really in terms of our healthcare system and healthcare infrastructure, not just in terms of the hardware, but the software as well. And the second area is really in terms of education, as Hafiz pointed out as well. I think we haven't yet seen, or we won't see the negative impact of this lost year for our children, that's going to lead to pretty much a human capital challenge later on, I think. And that's not just for Malaysian children, but also around the world, except, we didn't really concentrate very much on delivering education from a distance, and we might see the negative impacts of that. And I don't know if the 12 Malaysia Plan actually addresses that directly.
Dr. Carmelo, I believe you have gone through back to back of the 12 Malaysia Plan, so maybe I would love to have your insights on this.
Yeah, unfortunately, I had to read it all, and was not a very pleasant experience. A general I have two general comments before going into the details. And one is that is a Malaysia plan that is full of slogans. So you can see all these words like enhancing, enabling, strengthening, resilience, talents, entrepreneurship, circular economy. It seems that all the words that are fashionable into the current discussion are put there without a real critical assessment on what they mean. And secondly, without really declining these into a strategy. So we can all agree that we want more talents, let's say, in the country, but but then is not really explain how we want to do that, etc. So this lack of planning, strategic planning, is very much present in the plan. The second general comment is that from the Malaysia plan, indeed, I'm not a very big fan of 5-year plan that has always a very Soviet taste, you know. So indeed, it has a Soviet taste in the sense that it seems that the government has the ability to set targets and to go there over a period of 5 years, like if the economy was an engine that we can steer from a central control. And I very much doubt that any kind of central authority, and not only the government, but even a single entrepreneur, could steer the complexity of an economic system which is made of billions of dispersed decisions every day into a strong direction. So the problem is that the Malaysia plan, rather than working on a framework that can unleash the potential of the country, try to set targets that need to be reached with a centralized command over the economy. So this is the biggest probably shortcoming of the Malaysia plan. And indeed, where instead there is a space for the government to act, like conceiving an education reform, which is very much needed, but in the opposite direction that many people think. I believe that we need to re-put the humanities at the center of our education system if we want to create really innovative minds, or reforming the social safety net, reforming the healthcare system. All these structural problems are absolutely not addressed, and remains only principles, enunciations, without a real strategy on these points. But instead, they say, okay, we want to grow the GDP of a certain percentage over this year. We want to have a certain number of new entrepreneurs in Sabah and Sarawak. We need to invest in these kind of agriculture activity. So those things that should be left to the private initiative and to the interaction between market forces are advocated as a sphere of intervention of the government, while the actual sphere of intervention of the government is not touched at all.
Very interesting. I will get back to that. I think I will very interested because I think when we talk about healthcare education, it seems that even within the panel here, there's a assumption that states should intervene more, right? So I think we will get back to that, but I would love to hear Hafiz's view on the 12 Malaysia plan. Go ahead, Hafiz.
I think more broadly, I want to pivot more broadly to what we require, right? Investment in healthcare system, investment in education, not just in universities, but increasingly more on early education and primary education. because those two actually are cheapest to intervene and probably has the highest positive impact in the long run. But in order to do this, I think, especially after what happened as well during the past 2 years, I think it's inevitable taxes have to go up, right? I think if you want to do this, taxes have to go up. And if you look at it as well, I mean, one thing that make that practicable, I think, is that Malaysia tax base is probably one of the lowest in the world. And even if we are, we don't like taxes, but by that fact alone, we should tolerate higher taxes. Either I would assume in terms of capital gain tax, which again, Malaysia is probably one of the few 5 or 6 or 7 countries in the world that doesn't have capital gain tax, or estate tax, or even like, I might get bombed by this, but VAT, right? I was in that government that abolished VAT, but I think VAT is a GST. It's probably more superior and better for the economy. And we needed the money anyway. It was mismanaged, but we needed. But in practice, in theory, we do need those kind of taxes, right? And without these taxes, you cannot invest in hospitals and healthcare, for instance, right? Because right now we're spending about 2%, about 1.something% of GDP on healthcare, and that is, first of all, is lower than what upper income countries pay for. It's probably closer to 5%, and we won't get that if we don't have the tax measures to address that. And there's another point I want to mention. There's also, I think in Malaysia, we a little bit of scared of having a 3% GDP, 4% deficit, fiscal deficit, right? So I think in the next 5 years, I think we shouldn't be scared of running a higher deficit numbers, just because we need to repair the damage that's been done. And when you talk about high deficit, we don't have to intervene in the economy in terms of giving money to AirAsia, for instance. Instead, we could make investment in healthcare system, raise the amount of spending from 2% to 4%, and that means probably equipping the hospital better, manning the hospital better, absorbing the doctors that we might need, especially given that Malaysia is having a demographic aging, right, in the next 15 years, 20 years. So we should prepare for that. In order to prepare for the demographic aging, we need to do it right now, and we are not doing it right now. So that's really a case of spending more on healthcare, or doubling the spending from 2% to probably 4%, or even closer to upper middle class countries of 5%, I think, I'm speaking last I checked. And of course, there's also education that we need to invest. We have to invest better teachers, pay the teachers and the professors more, right? Because we are past the time where we can, sweat our way into manufacturing and power the GDP growth. We are in a situation where we need human capital, and in order to boost human capital, we need to invest in our education. If you don't invest, and then we just got to be stuck in low tech manufacturing, which, by the way, Malaysia has been experiencing since 2000s, right? When China joined the WTO, suddenly Malaysia faced this cheap manufacturing giant house to compete, and we failed to compete. And now China is no longer cheap. That shows how far we have gone, right? We still start there, and China has moved up in these 20 years. So we need to invest in infrastructure, invest in education. But I think the third thing, apart from healthcare, education, another thing we invest is probably telecommunication infrastructure. We are doing that right now in terms of 5G technology, but deployment has been painfully slow. And if it's slow, we wouldn't be able to get the first mover advantage and attract all this MMC to come to Malaysia to take advantage of our internet speed, right? They won't, because what we will need in terms of 5Gs, in terms of, I suppose you call it reindustrializing Malaysia. We need to have like data centers, all these regional centers that like the like of Google or whatever the small one, Stripes, in terms of payments. Payments technology is a big one these days. But we wouldn't be able to do that if our infrastructure into telecommunication is slow, right? In KL, for instance, there are still a lot of condominiums or office buildings even that runs on copper wire, which is crazy. Those are not fiber optics. And we need to talk about 5Gs now, and we don't even have a fiber optic for 4Gs, whatever. And those kind of investment we need, and the investment has been slow, and that means the government had to spend on this. Basically, government have to intervene on where there are public benefits, there are public infrastructures, there are public commons. You have to invest on commons, right? Healthcare, education, this infrastructure, backbone infrastructure, these are commons. We don't need like area shelf to save area shelf, for instance. We get money to benefit our infrastructure rather than private industries.
I will get back to that. It's quite interesting because I believe 12 Malaysia Plan talks a lot about digital economy, about this thing, and whether this in basic telecommunication infrastructure, as Hafid said, is being addressed to this. But let me just ask you one question. I think it's very interesting to say that you said tax will eventually be needed, right? But in the current situation, when do you think we can introduce new tax or even increase the current tax? Right. I believe you wrote a blog quite strongly that it's not the time for us to have tax now. But how long do you think we should freeze that?
I have a working paper on this with RIPSA. It's just that we're just waiting for the right time to release it. But I've also presented the paper to the Minister of Finance earlier. So basically, we need a long-term plan in terms of tax, right? In the short term, we probably cannot introduce new tax. In 1 year or 2 years, probably no new tax. What you can do, you do the low-hanging fruit, like you introduce tax identification numbers that has the benefit of not introducing new tax burden, but that makes the entire economy more transparent by assigning unique identification number to every single transaction that happened and every single person and every single company in Malaysia, as well as company that abroad that does business in Malaysia, right? You have the tax identification numbers, and then you can catch tax dodgers or whatever people manipulating the tax system. So that's easy to do. I think the Finance Ministry has indicated that they will be interviewing this next year, if I'm mistaken. So those are the things. And another easier thing to do is probably making the income tax more progressive slowly. That's probably going to be done in the next 3 or 4 or 5 years. That wouldn't affect the economy that much because the top income tax brackets probably affect a couple of thousand people. And yeah, and then but in terms of like real tough tax measures, that probably longer in horizon, probably like after 5 years or even 10 years. Like GST probably gonna take quite a while, right? Because there are political opposition to it, and the political opposition to it is very serious, and it's very hard, and it's probably you need to take care of the political aspect of it because it's more damaging to do GST, remove it, do GST and remove it. That's probably more damaging than actually not doing it at all. But the other taxes like capital income tax gain, for instance, that's easy to do in some ways because Malaysia is one of the few countries in the world that doesn't have it, and we can have very high threshold to remove a whole bunch of people, a whole bunch of retail investors from being hit by capital income tax gain. I think capital income tax is also appealing because if you think about it, there are 2 ways to gain income, right? In terms of wage income, labor income, and capital income, right? Capital income. The way Malaysia works is that we tax labor income but capital income is not taxed. And the thing is, most people, they earn their income from labor. They got taxed. For the very rich, capital income are not taxed at all, and they got fee income, right? So you can see this happening in some ways in terms of BRIM payments, right? You can see people that own 3 or 4 houses getting BRIM payment or BHS payment because they have no income. There's no labor income to the report of income, but they definitely have capital income. So there's something wrong in the tax system that have unbalanced treatment between labor income and capital income. So those are the things that can be done in it, but this cannot be done again in the next
in short term.
In the short term, right?
Years.
Because
Okay.
the economy is not stable enough to
introduce new taxes.
Absorb taxes. It can
Thank
be
you
done.
so much, Hafiz.
Yeah.
There are quite a number of questions, interesting one, and actually they want us to get back to other the discussions about the lockdown and everything, this early intervention during the pandemic. I think let's take this question first before I really want to talk about, like, three of you seems to be agree that state has to intervene more when it comes to education and healthcare, and some of it, like what Hafiz called as commons, right? And do you see that actually private sector can play that role, and how do you see it? Like how the government, how do you see the role of private sectors in providing this basic commons for the people? But let's take question from the audience first. I think this is a question on Sweden lockdown. Of course, Sweden, we know, took a contrary approach, no lockdown at all, and quite successful in weathering the storm. So if we were given, do you think if the government, I think this is a really good question. I think right now we see a very overly centralized approach. If we were given, if we learn from Sweden, let's say we don't do lockdown, or if we are given more autonomy to the states to decide, do you think we would be, doing better today? Who wants to take the first questions? I'm not going to give to Nadia now. Okay, go ahead, Dr. Carmelo.
I just want to answer because in particular during the first year of the pandemic, I have taken a look at the data of different countries divided by macro areas. And my very provisionary conclusion is that somehow at the level of macro geographical regions, numbers more or less equalized. If you look at the number of deaths per million people, independently from the strategy that is being adopted. So the question in my mind is that indeed we discussed lockdown, but I guess that somehow the countries that have adopted a very strong strategies at the beginning has only delayed the problem. It's the case of Malaysia. You compare Malaysia and Indonesia. Malaysia was always quoted as an example when Indonesia instead was going down a different path with no real and no serious lockdown. But in the end, what happened is that Indonesia entered the endemic phase of the pandemic earlier than Malaysia. So now Malaysia, in terms of absolute death, even in terms of relative deaths, overcame Indonesia. But Indonesia had that number of deaths earlier in the period. We look at Singapore now. Singapore entered that stage that Malaysia entered probably in March or April this year now. So probably and in Europe has been the same. So the strategy really didn't make a difference in terms of numbers at regional level, with all the due exceptions. Numbers are very much equalized. So I think that most probably we have reacted out of not knowing what to do, and even disregarding, as I mentioned earlier, the documents from the WHO, which were clearly mentioned that there were no evidence that lockdowns could have been a solution. On the regional approach, I think that is a good perspective, because indeed, in particular in countries that extend over hundreds of kilometers, north-south or east-west, there are different conditions, different population density, different lifestyle, that suggests that a centralized approach indeed doesn't take into account this kind of differences that it can play a role in handling the pandemic.
Thank you, Dr. Carmelo. Nadia?
Yeah, so I think this begs the question of whether or not our interventions are actually science-based, and I think we're going to witness a very interesting discussion about in the next panel, because those are all health experts, and I don't think any of us here are. But essentially, I think we didn't quite follow the science when it came to the relevant government intervention. So even in terms of lockdowns were never meant to be a long-term measure or even a medium-term measure. They were meant to, it's a very, very blunt instrument because we were facing a virus that no one really knew how it reacted in the first, when it first appeared on the scene. So I guess in that instance, maybe lockdowns were quite necessary in terms of allowing the health system to actually figure out what the appropriate health interventions were to in order to address the virus. Unfortunately, I think we seem to have also forgotten that what governments are supposed to do, or rather policymakers as well as the public are supposed to do during the lockdown, is actually increase the capacity of the healthcare system. So the lockdowns are really essentially a measure to allow the healthcare system to recuperate and actually increase its own capacity once the lockdowns are lifted and the possibility of infections rise. I don't know whether we did that, as well as the way that Malaysia actually implemented its lockdown. So I'm afraid that the only precedent when it comes to these sorts of restrictions of movements that Malaysia has seen before this was when we, had the communist insurgency crisis back in during the emergency between 1948 and 1960. So I'm afraid the standard operating procedures and the way that the government operated the lockdowns itself was based on that. So it wasn't really in terms of addressing the spread of the virus, but really in terms of wholly restricting movements, which is why you saw odd measures such as, restricting the operating hours of essential businesses, and we've had a discussion on that, as well as restricting the hours of operation for public transport, when if the intention was actually meant to increase physical distancing, you would want to spread out those working hours so that there would be less people congregating in one spot. So, so I don't think it's an apple-to-apple comparison when we're comparing to cases like Sweden. So you've got New Zealand on one hand that imposed a very strict lockdown, but it's a very small country, and as Carmelo mentioned, so that sort of centralized measure would have been appropriate as opposed to Sweden, which has a different sort of culture in terms of distancing, in terms of private, any kind of private culture of distancing themselves and keep and ensuring that they themselves protected in terms of the virus, as well as the capacity of the public health system. So I'm afraid what we're seeing now is, or what we saw before, is the government resorting to lockdown as the end-all be-all measure of addressing the pandemic, instead of a very targeted short-term measure that would allow to increase the capacity of not just the public health system, but also the general physical environment that we live in, right? So, when people talk about returning to normal, I don't think we're ever going to see life return to the normal that we saw back in, in BC before COVID, because we're going to see like the next pandemic appear, and we haven't really spoken about our physical infrastructure in terms of ventilation, in terms of hygiene, in our public spaces. So when we talk about the necessary types of government intervention, I think what we need to do is kind of like go back to basics. So when is government intervention necessary? And in the first place, if there are some market failures, such as, if there are positive externalities to be had that cannot be covered by the private sector, I have talked about the commons. So, in order to avoid tragedy of commons, government intervention needs to come in. But, just coming back to Carmelo's point about how the top plan kind of ignores, the structural interventions that are necessary. I think we really need to highlight that, because so far we've kind of had a discussion in terms of the fiscal interventions, right? Government monetary interventions, but we haven't talked about institutional reform. We haven't talked about how public services are meant to be delivered. Is this highly centralized public service delivery system appropriate for a country kind of divided in half like Malaysia is, as well as the very nature of public services delivery itself that requires very localized input. As well as, you mentioned government capacity, that hasn't really been examined throughout this crisis or in the 12th Malaysia Plan. And I think it's a bit of a missed opportunity because, as Hafiz does rightly point out, that, there are parts of the government or some frontliners that actually do deserve to see an increase in pay. But on the flip side, do we have a bureaucracy that is maybe too large? And is unnecessary. Sorry, I'm taking a bit too long, but just another point in terms of tax. So you asked, when is it appropriate to impose tax? Well, coming back to economic theory, the most appropriate point is when you begin to see a positive output gap, and in order to impose fiscal consolidation, not just in terms of increasing taxes, but also in terms of reducing expenditure, right? And I think a lot of macroeconomists currently don't estimate that Malaysia is going to get a positive output gap until about 2024 or the midpoint of 2023 at the earliest. So yeah, so we haven't even taken a look at the supply side intervention. So when we're talking about inflation, it's really currently a supply side shock that we're seeing. So we haven't really talked about addressing that supply side shock.
I want to talk about that later on, but Hafiz, do you have any comments on these questions, on especially I think on whether it's possible, given Malaysia's, it's like medium-sized country, right, to have that sort of less centralized and given this room to state government to actually decide to themselves on what kind of intervention that actually need to be done to tackle the pandemic?
Yeah, I think at this current moment, 2 years past intervention, when we know a lot more and we have the institution and infrastructure to do it, we can do that decentralize it, right? But coming back to the question of Sweden and probably the first 6 months of the 12 months, again, I have to stress that there's a lot of uncertainty. And then there was a need for precautionary measures, and lockdown was one way. It was blind. The problem with Malaysia is that we did mistakes and we made the lockdown longer than it should, and we resorted to the lockdown as a solution rather than the temporary measures to do whatever Nadia said just now about boosting our healthcare capacities. So coming back to Sweden, with that in mind, I don't think Sweden was that successful. I would challenge that actually. When you talk about Sweden, you have to compare with neighboring countries like Denmark, Norway. If you look at it, their GDP numbers, even Sweden, fall at about -3% in 2020. In Denmark, about the same. Norway, about the same. Finland, about the same. But what different was that the death rate in the first 6 months or 1 month in Sweden is much higher compared to their neighboring countries that did lock down. So if you do neighboring analysis of this thing, you compare the GDP numbers and the death rate, I would say Sweden failed in their response. Sweden isn't an example of a successful response for the first 6 months or 1 month or 1 year, but just because of death rate was higher than their neighbors.
Thank you. I think let's move on to this. I really want to talk about, again, the systemic issue that we haven't seen that the government is taking this quite seriously. But I think I also see that all of you seems to suggest that the government should take a more broader role when it comes to healthcare and education, right? How do you see actually, but would it be then we create, more dependence on the government where actually public service delivery has been always a problem? And shall we actually look into the role of private sectors in ensuring, say, education reforms, healthcare provisions? How do you see private sectors can play a role in this? Who wants to take first? I'm going to do this now.
I'll start.
Okay.
Ladies first, sorry.
Okay, Nadia, go ahead.
So I can say what I need to say without anyone jumping in. I think some panelists might disagree with this, but the private sector, it depends on the private sector, is really based on the fact that the private sector has a profit-making motive. So, it begs the question of whether or not certain interventions would align with this profit-making motive of the private sector. So take a look at healthcare, for instance. Quite a lot of healthcare infrastructure actually does not make money for healthcare providers in the short term or the medium term. So, even in Malaysia, what you see is a lot of very expensive healthcare equipment is only provided in government hospitals simply because, private healthcare providers are really tied to, the requirements to make profit, and the costs of providing these services are simply too high. And you can see the effects of a completely privatized healthcare system in the US. So, which kind of provides a counterfactual to whether the efficiency of a completely private system, right? So, there is, I think, a lot to be desired in terms of our healthcare services, but I think the service delivery issues that we see are really in terms of a lack of capacity that requires investments in the system, as well as a restructuring of how services are delivered, as opposed to pulling back on that intervention. And Hafiz rightly pointed out that we've severely actually underinvested in our health infrastructure, and that's something that needs to be looked into.
Hafiz, since you I think go ahead. I'm gonna give it the last to Dr. Carmelo.
Oh yeah, in terms of healthcare and education, I think the government, the public sector has to take the lead, right? I have no qualms of allowing private hospitals or private schools existing, but in terms of providing leadership, public sector has to, because first of all, we have to think about the original role of government. It's providing services, basic services like health, security, education. All these are basic services that you need, and the government has to take a role in this thing. They cannot outsource the leadership to the private sector. In fact, in the COVID, for instance, in the COVID pandemic, for instance, the private sector was so scared of COVID, they didn't even take COVID cases. They would just refer it to the public hospital. Why? Because first of all, it's not. This COVID, a lot of this COVID patient cannot afford to pay anyway, and private sector didn't have the expertise in handling COVID, right? That shows that the public health system need to take leadership in health issues. And again, I said I'm okay with having private clinics, private hospitals, fine. But it should work as augmenting the public health system, and the public health system has to be equipped with the best person, best equipment, and the technical know-how, right? Because again, if you talk about in Malaysia, the one that trains all these doctors, all the specialists, are the public hospitals, not private hospital. Private hospital, what they do is that they pinch talent from the public sector because they can pay more. So that's also a problem, right? That shows that we need to improve pay in the public sector to what I call that, to ensure that the talent wouldn't go away from the public system. Because in democracies, the one that takes leadership is not private sector in terms of healthcare, it's public sector. So this is a strong case. There are other cases like this in terms of security, for instance, the police. You don't outsource the police to the private sector. You don't outsource the prison to the public sector. You don't outsource like the collection of road tax to the public sector, which is happening in Malaysia, by the way. This is wrong, right? This is wrong kind of privatization. You can privatize things like, like power generation, because power generation is no longer a national monopoly. We have figured out a way to make it work in terms of institution, in terms of aligning public interest and public interest, or even water in some ways. You can't do that. We can allow that to happen. And the government should avoid, for instance, in participation in like aviation, for instance, or kind of other kind of services that private sector can provide. But in terms of public services, like again, I'm stressing, I'm repeating myself: education, healthcare, security. This public sector should take the lead, and this is the reason why we need better funding in this area to prevent it to be being outsourced further. And at the end of the day, private sector is profit motivated. There's a profit motive among private sector. There is always conflict of interest when it comes to crisis in this sense. So this is the reason why public sector has to take leadership in these areas.
Okay, Dr. Carmelo, go ahead.
I will tackle this in a bit pragmatic way, coming also from a socialist country where indeed the government has taken not only the lead, but the monopoly of education and healthcare. And once I confronted myself with the mixed system of Malaysia, I found the mixed system of Malaysia much more efficient. You know, if I go back to my country and I need to book a visit for my eyes, I will get the appointment now for 2023. You know, and therefore, despite paying high taxes in Italy in order to have access to the free healthcare system, then if I have really a problem, I need to go to the private sector that is very expensive, and a totally monopolized system by the government is also terribly regressive, because the fact is that in the end, the rich and the poor pay the same in the government service. So basically, the poor are financing the services for the rich somehow. So I think let's consider the positive point of Malaysia, where so far a virtuous mix of private and government action in the education and healthcare system has worked pretty well. Okay, we have undergone a shock that had put all the systems around the world under pressure, not only the Malaysian, not only the American, not only the Italian, and etc. So I think that we should work to strengthen the virtuous system that we had in Malaysia and to overcome the shortcoming. And in this sense, I think that the better way is for the public provided, for the government provided services, is first of all to introduce a sound mechanism of incentives, because one of the biggest problems when the government provides services is that indeed often the good outcome is left to the goodwill of the operators, because there is not really a mechanism of incentives that punish or reward performances. So this needs to be one of the criteria. The second one, I think, is to introduce and to educate a mentality according to which everybody should be equipped with an insurance. And insurance are of different level. Okay, so there are different insurances with higher coverage, and indeed in Malaysia, even a very basic insurance can provided by the private sector is relatively cheap. But let's have eventually the government to enter this market, providing their own insurance in a competitive system that is mostly affordable for the poorest segments of the population, but introducing the criteria that you should pay for it, and not necessarily via taxation, because the money that you pay via taxation are later on spent in all the different ways. Doesn't mean that the money that are intended to go to the healthcare goes to the healthcare, and to education goes to the education. Even in countries like Italy, where you have taxation close to 50% of income, and still the services provided are often of a very bad quality. So introduce targeted payments rather than financing this infrastructure through taxation, but so eventually reduce tax, but introduce more direct payments. And I think that the third measure that I would introduce to reform the public sector is to introduce different prices. So now the idea behind the public sector is that everybody pay the same or close to nothing. And as I mentioned before, this is terribly regressive in the end, because the rich has access to certain services at the same price like the poor. So I think the government should provide those services at market price as a starting point, and introduce deductions from the market price according to the income level.
I think Singapore applied that, if I'm not mistaken.
Maybe I don't know, but so I would. So my point is, don't throw away a system that has worked pretty well. Also, not only in healthcare but also in education, has provided a variety of supply, and this is good for the consumer, because you have also private institutions that cost 1,000 ringgit a month, like private institution that cost 20,000 ringgit a month. So the supply is pretty wide, and this is beneficial for the consumer. So don't throw this system, but perfect it, improve it, and keep indeed a role for the government for emergency purposes. So the fact that we have been unable to face properly an emergency, but basically all the rest of the world has been unable to do so, doesn't mean that we have to have the government doing everything every time, but reform the system in a way that eventually the government is more able to tackle the emergency, not that we transform the normal reality into an emergency, because we don't live in an emergency, in a perennial status of emergency. We live in normal times. The last pandemic was 100 years ago, so we don't need to live 100 years in a state of emergency in order to be able to tackle the next emergency, because this is going to make our life a hell. And probably if we adopt that system, I will never go back to see my family in Italy with all these SOPs. So let's live with realism, create a strategic management of emergencies, but let normal times to be handled in normal ways. Otherwise, because a perennial status of emergency can create a hell.
This is there's a question from the audience, but I think I would just reword it a little bit. From your, I don't know whether you have done some research on this, some reading, did the health sector, centralized health sector managed by the government, so countries with that type of healthcare system, like the UK or Italy, in this case, handle pandemic better than mixed system like us? Has anyone, I mean, have you ever seen any research on this, or maybe you can share some of your observation?
But honestly, I have seen obviously I've observed the case of Italy, and you know, of course, Italy was at the center of the pandemic at the very beginning, and my family was in the hot spot in one of the regions that was the hot spot, and at the beginning it didn't work well. Indeed, what happened is, and now there is a big polemic on this in the country, that the protocol suggested by the Ministry of Health was wrong, and is coming out slowly that many deaths could have been avoided if the suggested protocol, which was wait and see and take tachipirina, this was the protocol: wait, see, and take tachipirina.
Oh, tachipirina. Okay.
If this protocol was not observed, and the doctors that were more able to save lives were those doctors that ignore the protocol and ignore the idea of wait and see, and acted promptly with a different combination of medicines, and of course early detection was key, and therefore the importance of frequent testing and so on. So it is really emerging that the centralized management of the pandemic from the Ministry of Health in Italy has been the cause of many deaths. Then there has been a big problem with communication, and another bomb that exploded in the communication system in Italy a few days ago is a document produced by the Ministry of Health itself, according to which from the 130,000 more or less deaths of COVID that we had in the country, the actual deaths of COVID were 2.5%. The others were not COVID, but people that died of other illnesses that they already had. This is not coming from negationists or libertarians people, but it's coming from the Ministry of Health. So people are now wondering. I mean, we have lived with images of tanks carrying out graves and people burn. I mean, all these responsibilities of the communication system. But now it came out that the numbers was only 2% of the numbers that has been communicated so far. So the central management, and another issue was that autopsies were forbidden by law. So those doctors that were trying to understand more about the cause of death, and indeed this was fundamental, because then those that found that did the autopsies violating the law found the problem that indeed people died of blood clots. So it was not a respiratory problem, but a blood clot problem. So to ventilate people during at the beginning of the pandemic was killing the people indeed. So people were killed by excessive ventilation. And this information has been kept hidden by the centralized management of the pandemic and are coming out only now. But I mean, I guess the bottom point is that in the case of Italy, the centralized system has killed probably more people than what could have died if we had tackled in a more decentralized way.
Any other observation from both of you, Hafiz or Nadia? Maybe from your readings or observation?
Okay.
No, okay.
No, I went first just now, so Hafiz can go.
Okay, go ahead, Hafiz.
I think it's important to note two things, right? The weaknesses of centralized system and the nature of the crisis, right? And the weakness of centralized system has always been that if the top make a mistake, then the mistake gets distributed evenly throughout the economy. So that's a problem, not just for health system, also in terms of economy, right? In fact, in economic literature, not talking about health, about centralization or authoritarian, whatever, you could see that in general democracy, which can be seen as a decentralized system, probably have no difference in terms of economic performance compared to authoritarian government, right? But the thing is, for democracy, the variance of performance is smaller compared to authoritarianism. In authoritarianism, because it's a decentralized system, if you make a mistake, you can go all the way down. But if you're really good, like Singapore, you can go all the way up. But in terms of democracy, you sort of mitigate that mistakes, right? So that's one weakness of centralized system, right? The variance is so big. It seems like in terms of Italy, the outcome seems to be very down there somewhere. But there are other centralized systems that doing much better, right? In terms of Singapore, I suppose, which is despite it being so, it is
Centralized, I guess.
But another thing is that we're coming to the second point, which is nature of crisis. Nature of crisis is pretty much a public crisis. It's a sort of a commons crisis of the commons, if you can say so. In the kind of crisis, you do the optimum infrastructure to address it is really a centralized system. Because if you have a decentralized system, then everybody will do their own thing, and they may achieve the best outcome for their own particular segment, but in terms of the whole common, it might be worse, right? So there is an opportunity cost over here. There's a trade-off between the weaknesses of the system and the nature of the crisis. The nature of the crisis demands a centralized system, but if it's centralized system make mistakes, then you make the whole thing worse. So this is that problem that you have to handle.
A trade-off, yes. Nadia.
Yeah, so I think the original question was whether wholly private or public healthcare service system. So I think we've kind of agreed that the nature of the crisis itself was a public nature, and overall private healthcare systems, because they were not equipped enough and because, again, this profit-making motive, I don't think a wholly private healthcare system would have been able to cope very well with addressing the COVID-19 pandemic. And I think what we're talking really is in terms of what sort of structure would be the most appropriate or adequate to address this sort of public health crisis. And it really is, I think, Carmelo and as well as Hafiz has already touched on, a wholly centralized system versus a decentralized system. And I'm going to take a leaf out of Hafiz's book here and kind of pick the middle ground in a way in terms of deciding, yes, I think in terms of the overall national strategy and balancing between disparate interests, you need a sort of centralized center of command. But in terms of dispersing those services themselves and deciding what sort of resources are required on the ground and actually be empowered to obtain those resources, those need to be centralized. So what we saw in terms of Malaysia's response was because everything was centralized, it led to a lot of uncoordinated efforts and disparate sort of progress in terms of addressing the crisis. So, there were times when, certain hospitals found themselves woefully inadequate, in very dire circumstances in terms of shortage of equipment, but the hospital management themselves weren't able to source for the equipment required because everything had to be centralized. So in that sense, I think there needs to be a balance between what should be at a central command system and what should be decentralized. So when it comes to actually the on the ground operations itself, that desperately needs to be decentralized. But in terms of what needs to be centralized, I think there's a call for perhaps, a centralized strategy that outlines, what are the benchmarks in terms of, what can we, what do we call an emergency, for instance, and as well as standards. One of the issues is that, and Carmelo highlighted the example of Italy where, some deaths were not actually related to COVID. I think also for Malaysia, there was an issue of, different districts having a different definition of what entailed a COVID-related death. So I think really there's no either or here. I think there's an opportunity to look at the nuances that are required in the whole structure itself of public service delivery and strategy.
We have about 30 minutes left. I think I just want to have.
Sorry, could I add on that?
Okay, go ahead.
I think that highlight is just like the fundamental issue, right? Is really institutional design. It's not so much you arguing between decentralized system and centralized system. It's just institutional design, how institution can work. You can be centralized in some ways and decentralized in some ways. So I think this discussion about institutional design, we should talk about institution in general, needs to take a more center point rather than talking about ideological authoritarian democracy.
Intervention or not interventions.
Yeah, because that's argument between like the two pole is so 1980s, so 1990s, right? Because right now everything's mixed in Malaysia, especially.
Yes.
Everything is so mixed. It's very difficult to live. To jettison the system and go for one particular brand or the other. Yes. We need to think about institution design that take into account all this nitty-gritty variables, which doesn't really fall neatly between centralized or decentralized system.
Yes, agree with it. I think that's why I think how do we actually strategically use this opportunity to design this system, right? Either more or less government intervention. Just one question, and I think I would be very interested to just talk a little bit about government capacity, especially in terms of financial capacity, before we end our session today. I think there's a worries among the public that the government will increase again statutory debt, and then this and that. So I think, and then we're seeing that it seems that we're gonna see a more higher deficit. How long do you think this type of, a bigger fiscal expansion should happen, and whether should we worry about borrowing level of the government at this point, and how long can we not worry about it? I think. Nadia want to start first. Go ahead.
Yeah, so whenever this question pops up, I like to point out that that Japan has run a fiscal deficit to GDP of 200% for decades now, with no, structural detriment. Well, apart from, I kind of problems with its economy that's related to its demographics, for instance, as well as its lower rates of growth. But in terms of, problems in terms of fiscal sustainability, that hasn't cropped up. Singapore, you'd be surprised, has actually been running a fiscal deficit of about or rather, sorry, in terms of net debt to GDP, it's about, and that was for Japan as well, it's 200% of debt to GDP, whereas Singapore has a gross debt to GDP of 110%. The difference is that Singapore's government has always highlighted that in terms of its net debt to GDP, it's actually zero, and it's able to talk about net debt because it balances the debt that it's produced with against the assets that debt is financed. And I think this is what's been missing from the discourse on statutory debt. It's not really in terms of the quantum of the debt itself, because, we all know that, government debt is not the same as corporate debt. It's not the same as income debt, as a household debt, as long as the country itself is a going concern. The size of the debt is not as important as what that debt is financing and what is on the asset side. And we haven't really seen a proper accounting of that. We know that legally government debt can only finance development expenditure. But what would be interesting to see is what has what sorts of development expenditure, what sorts of public investment has that debt been spent on? So, has it been spent on infrastructure that's going to generate structural growth later on? Or has it been spent on, say, white elephants, or anything that's not going to generate any sort of sustainable economic growth? So really, when it comes to fiscal space, there's always room to generate more fiscal space. And Carmelo mentioned inflation. Interestingly, one of the ways that governments can sort of reduce the quantum of the debt is to inflate away the debt. But a bit irresponsible, but it doesn't mean that governments have not resorted to that. But that debt, as well as government spending overall, has to be able to generate growth as well as social economic well-being for the people. So
on
I
Japan,
think we
can I
put
ask
too
a
much
question?
focus. Yeah.
On Japan, does it include the liabilities and also guarantees?
I'm not sure, but it's a total gross debt. So I'm not sure whether it includes contingent liabilities, but it's actually, I think most of the times when we're talking about government debt, it is really very much direct liabilities of the government, whether it's external or internal. And as long as there isn't really too much of a concentration on external debt, the focus should really be on the accounting of that debt, as opposed to the quantum of that debt. I think too much focus has been spent on the quantum of the debt instead of on the other side in terms of the assets.
Need more scrutiny, actually. What are these monies
Absolutely.
being used
And
for?
this really goes back to institutional design, the overall structure of how we think about public service versus private service delivery in this country, the role of the government in business. I mean, this is a whole overall discussion that we really should be focusing on, instead of questions of whether there's too much state intervention or too little state intervention. I think we need to go deeper and think about the types of state intervention and the role that the government has to play within the economy, as well as what its responsibilities are.
Dr. Carmelo, I think I'm going to go to Dr. Carmelo first. Hafiz, go ahead, Dr. Carmelo.
Yeah. Okay. On this, there is first of all the problem of inflation that Nadia has re-mentioned, because all the money that the government cannot raise via taxation, but the government want to spend, need to be raised via debt or via printing money. Okay, so and inflation is an hidden tax, in the sense that becomes the way in which purchasing power of the people is destroyed in the long run, and it creates less opportunity in the future, because there is no way to run away of persistent inflation without passing through a certain level of unemployment. So we have to look not simply at saying how sustainable is, from a fiscal perspective, a certain amount of spending, but which other consequences that amount of spending is bringing to the system, and inflation is one. And again, in this peculiar historical circumstance, because of the heavy already fiscal spending, the extraordinary low interest rate that are combining together with the supply side shock that has emerged as a consequence of the lockdown, in the moment in which the economy will actually restart, this of inflation is becoming a real tragic issue. And in the West, this is already happening. I don't know if you have read about the cost of energy, but not only. I think that the latest data on inflation in the US was something like 5.4%. So inflation is starting to run in the West at levels that we have not seen for decades. And this is going to destroy future opportunities of development, and to bring along unemployment. So this is the very first issue that we need to mention with reference to the current circumstances. Then, more in general, while I do believe that the government has a role in creating the adequate conditions for a virtuous economic development through the development of the right institutional framework, I I'm also quite skeptical on the fact that direct expenditures from the government can bring about necessarily a good outcome. We can be lucky or not. Hafiz has mentioned, indeed, when a centralized decision is taken, if you have an enlightened dictator, let's say, you can have good outcomes. But if you have the bad one, you have bad outcomes. And Hayek was used to say that the task of democratic system is that to avoid huge mistakes when you have bad rulers on the top, basically. So to come back to the point, I'm skeptical on the fact that indeed the government possess the necessary knowledge to deploy investment that are beneficial to the economic development of the country, because the government is not playing in the marketplace. So the government can say, we want to spend in certain infrastructure, in certain economic activity, because we believe that economic activities are good. But if you don't have the know-how, you don't have the expertise, and I give you a very practical example that regards your country, Uni. When both Jokowi and the previous administration decided that Indonesia needed to produce their own corn, because corn in a sense is an essential produce, and of course one of the basic consumption in Indonesia is chicken, and corn is the basic feed for chicken, costing up to 75% of the running cost of a chicken farm. What happened is that there was no know-how, no right soil, no adequate infrastructure, not the economic intelligence to produce adequate corn. And in the end, the locally produced corns were costing double than the corn importing from abroad. Okay, so we have to be very careful in defining which one are the targets that we want to achieve with the spending, and probably we can achieve much more by doing much less, but working on the institutional framework rather than on the direct economic action. So making so it is more beneficial for the Indonesian people to have a free market for corns, so that they can have access to the international market, buy cheaper corn on the international market, and therefore having at the end cheaper chicken, rather than forcing the local producer of chicken to buy local corns that are costing double the international market. So it would, rather than investing all that money in developing corn production, they could have developed better international agreement for free trade. It costs nothing and it produces a much better outcome. So
again, I guess the point is, it's not about the size, but what is it that is this money going to use for? If it's like for activities like this, which actually will not really beneficial for the economy in general, then better not spend.
So stay as much as possible on the institutional level, because defining the economic target is an entrepreneurial task, and the state is not an entrepreneur.
Okay, the last one, Hafiz, and then I think after this, let's round up. Go ahead, Hafiz. How do you see this? Debt target? No, not the debt target, because I think people are worried because the Ministry of Finance, right? He will ask, oh, another statutory, the increase in statutory debt, and people are worried about it. Is this worry actually justified, or is it's okay now to actually spend more and borrow more?
Well, I think in the short term, when the spending is just necessary, because the economy, or if you don't make any spending, of course, we can debate about what kind of a nature of spending, but if you don't spend, there's a danger, or what I mentioned earlier, about the economy growth trend becoming slower than before crisis. We experienced that during the Asian financial crisis. America experienced that during the subprime crisis. And this is another crisis, right? If you have a slower GDP growth, slower household income growth, then there's a lot of lives that depended on that, a lot of growth potential, a lot of potential that we're not meeting.
What's the concern of inflation that Dr. Carmelo and Nadia mentioned before?
Sure. But touching on the debt first, I think in the short term is okay in terms of debt. But I think the more important thing to worry about is really the debt service ratio, which is about 15%, probably 20% right now.
15, I think, 15, 16.
Yeah, 15, 16. This is rising essentially because of the debt level. That has to be addressed because you don't want government spending like probably a good chunk of their revenue on paying just debt, right? Because you need to fund all of these more productive activities, right? More like education system, for instance, right? You don't want to just pay money to the banks and the creditors. So that this goes back to the idea that taxes have to go up in the next probably 10 years, 5 years, 10 years, 15 years. It just have to go up. Or else you will see government just dedicating more and more of their resources to paying debt. I think that is not ideal. But in terms of inflation, I think because I also work at IHS market, so one of the things we do is that we, check the services like agriculture, coal, shipping, all these things, and that's indeed prices are going up all around the world. Just because of, it's not demand driven per se, it's mostly because of supply side issues. In Brazil, for instance, the ports are just clogged with soybean and corn because there's not enough containers, there's not enough ships to transport that around. And those are affecting, like, there's not just that, there's also semiconductor shortages around the world because of whatever happened in Malaysia during the lockdown. The lockdown has deep repercussion on semiconductors around the world. And then there's fire in Japan. So right now, what you see, if you want to buy cars, for instance, you have to wait a couple of months before the car comes. Because cars these days are electronics, right? There's no longer mechanical, they are electronics. And there's not enough semiconductors going around. So car production forecast, for instance, has been downgraded quite badly this year and for next year because of semiconductor shortages. And prices are going up because supply is just not there. But because it's a supply side issue, right? Their effort to invest in this thing. In fact, there are more ships being built, more containers are being made, being better distributed around the world. So because it's supply side issues, it's a matter of investment. So once investment has been made, probably in a year time or 2 years time, the inflation probably going to come down. This is a very different nature from demand side. Demand inflation. Demand inflation can be very dangerous a little bit. But in terms of supply inflation, supply side inflation, supply pool inflation, there are ways to address it. You just invest in your capacity, but have better capacities. Once the capacity has been addressed, the inflation will come down. So I think there is need to differentiate between supply side inflation and demand side inflation, and the solution for these things are very different. For instance, in terms of supply side inflation, right? You cannot just raise rates. It doesn't work. Doesn't affect anything. It just makes things worse. Makes the economy goes down. If you raise rates, for instance, Bank decided, the inflation coming down, so the central bank decided to raise rates. It wouldn't do anything. It just reduce demand and make it turn into a recession. What you need is just investment. You need investment in this capacity, investment in more semiconductor plants, investment in more ships, in more containers, better ports, automating the ports, for instance. In America, for instance, the ports are not automated for some reason. So America is behind in that sense. But if you automate the port, make it more efficient, all these things, you need investment, right? And that's how you address supply side inflation. So
thank you so much. It's very interesting. I really can't, but I know I've been holding you up for 2 hours now. I think let's end this conversation. I think there's a lot of things that needs to be discussed, but I think for me the main takeaway is that the medium term and slightly long-term government plan has not addressed the systemic problem that you mentioned on healthcare, education, and social protections. And of course, we are hoping that it can be addressed, in the budget 2022. But of course, the chance is quite slim, given that, as Nadia said, it's basically sort of an interpretations of the 12 Malaysia plan, right? So, but I think let's end discussion today, but any other last point that you want to, to convey to the participants? Who wants to start first? Let's start with Dr. Carmelo. Go ahead. 1 minute or 2 minutes. Let's, yeah, go ahead, Dr. Carmelo.
Yeah, well, I would remark the thing that you just mentioned is the long-term consequences of what has been done, and I think there is not yet enough reflection on this. I tend to, while I agree with a fifth that is different to address supply side or demand side inflation, I slightly disagree on the fact that the monetary part is not playing a role, and the increase of the monetary aggregates in the past year is quite a source of concern for me. So I'm strongly afraid that we are going to have a structural economic crisis when the economy restarts, and we need to start to think about it and how we handle it.
Thank you, Dr. Carmelo. Nadia?
Right. Again, I'm going to have to take the middle ground in terms of inflationary concerns. I think on one hand, Hafiz is right in terms of the current inflationary pressures being on the supply side shock. But the interventions that are necessary to address that supply side shock are going to take time to manifest themselves, right? To address them, because automation will take time, increasing investment, capital investments in general will take time. Just the very fact that we haven't really addressed the lack of resilience in the supply chain is going to take time to address. So within that time, I think issues related to policy sequencing is extremely important. So you don't want the economy to overheat too much when it hasn't quite achieved the levels of economic growth or economic recovery that is necessary. So Dr. Kamala's point is right, that when the economy recovers and these inflationary pressures are still remain very strong, you're going to get into a position where you might risk hyperinflation, although that's quite a limited risk. But the problem right now that Malaysia is facing is, in the external, amongst the external sector, is that there is a two-speed recovery in the global system, where the advanced economies have actually achieved a point of recovery where they're going to pull back on some of the reflationary measures that they've given. So that's going to put pressure on Malaysia to kind of pull back on the reflationary measures that the government has imposed in terms of easy monetary policy, and that might happen prematurely before the economic recovery has been sustained. I think so. That's my point. So I think again, this harks back to what I think the theme that we've been discussing today is in terms of structural issues, systemic issues, and institutional design that haven't quite been addressed by the policymakers. I mean, we haven't really seen that. We haven't seen that in the 12 Malaysia Plan. We haven't seen that in the public discourse that has been happening related to not just the COVID-19 crisis, but also, what is this narrative going forward? Previously, we had Vision 2020 that sort of drove. I mean, it was not quite manifested properly. And
we have
like Dr.
prosperity
Carmelo,
plan.
Yes, and all sorts. Yes, all this. But again, none of those plans actually addressed what needs to be addressed, which are the systemic issues. Hafiz touched on premature deindustrialization. No one has taken a look at addressing that. The role of balancing between competition and regulation in the government. There really needs to be more discourse on these sorts of structural and systemic issues, I feel, as opposed to talking about whether state intervention is necessary or not. I think the world has moved on from that sort of discussion.
Hafiz, go ahead.
I think for the next couple of years, I think probably 2 or 3 years, I think we just are condemned to having a government playing greater role, right? Whether we like it or not, that's the context we live in. We just have to do it, and because of that, we don't have to worry that much about debt right now. I mean, debt is going to come. That's why I said it has to be a long-term plan in terms of taxation, because you don't print money on tree, right? Despite the fact that a lot of people these days say that you can just print money, and it's not as simple as that, because the way things works with the monetary supply chain, it's a monetary supply pipeline, is just more difficult than just saying the central bank can just print money. you can do it, but it will be repercussion. That will be another kind of inflation that is more dangerous than supply side or demand side. But also at the same time, I want to say that in the current situation, in the next 2 or 3 years, I think it's good to worry about inflation because, for instance, right now there's an inflationary pressure. It's also affecting wages, right? Because for the longest time, wage growth in Malaysia has been very low and it's trailing productivity growth, and people can't really address it. So inflation pressure is just pushing that up a little bit. So this is one way to address it. So in fact, I would rather right now worry about this kind of inflation pressure compared to having a deflation caused by weaker economic growth. I think weaker economics is probably a greater evil than inflation at the moment, because if you lose this economic growth, you will affect generation of people in terms of their potential, in terms of their welfare, and again, you talk about economic growth, it's also affect government debt, right? Greater economic growth in the long run makes debt burden cheaper automatically. Right.
Thank you all so much. It's been a very insightful discussions, and I know that the turnout is quite low today, but we will post this in Facebook, and I hope it will generate more conversation, especially on the things that we discussed today on institutional framework, more discussion and public discourse on this. I think really matter, and it will push the government to move towards direction as well. So thank you again for joining us here with the 3 speakers. And yeah, and please tune to our third session later on at 2 p.m. I will leave it to Iskandar to announce. Go ahead, Iskandar.
Thank you so much, Sri Muniati and dear panelists, for the wonderful and lively discussion. And that wraps up the first session of the day. At 2 p.m., we will be continuing to the last session of our conference, which topic will be COVID-19 vaccination, balancing personal liberty and community interest. If you haven't registered for the session, by my colleague. Dear panelists, please stay on the line as we have a quick debrief with all of you. And dear guests, I would like to ask for your cooperation to please leave the Zoom call as we do so. Thank you so much, everyone, and have a good lunch.
Okay, I hope that